I have not talked to a lot of pharmacies who have actually used their drivers and educated them.
Oh, it's a thing CPSN is
I know with
recommending. So lots of
CPSN,
people are recommending that.
But how many CPSN pharmacies are actually using that?
I don't know. A lot of people are trying.
They're doing a community health worker rollout with CEI has a program that you can have your pharmacy technicians become community health workers. So it just teaches them what to look for. We actually have 2 on our team. One is our delivery driver that's also a tech. And then the other is one of our lead techs that's in the store. And so what I do is I have them attend all of our our county health coalition meetings and the Chamber of Commerce events. And so then they know what's going on in the community. And so if we have a patient that needs a resource, then they know, like we could just ask them, hey, Abby, do you know, is there anywhere that they could call to get a ride? And then she can tell us the 2 or 3 places. And then the entities in the community know that we're doing this. And so in turn, then they tell us when there's a new service added into the community. So it's just a sharing of information. And then we work closely with our health department to try to, at least once a quarter, meet with them and see what's going on and how we can help each other. And so it's
so tell us
really
again
good.
how you train them. How did you like the different?
Yeah,
I think the NCPA had a program. I think that you could do training. I think how did you train them to become community health workers?
Well, okay, so I actually heard Trip Logan. I think I was on this podcast, and he was talking about CHWs.
Yep,
So then
that was early.
NCPA.
That was several.
That was early.
Yeah.
That was
Yep.
like in the first 10 episodes.
So then I was at an NCPA meeting, and I saw Trip, and the poor guy, I beeline across the room, and I was like, I heard you talking about community health workers. How do I do that? Because it makes so much sense to me. And he's like, he told me, that he worked with this health department, and then he said that there's most states have a coalition. So I immediately got on my phone and Googled, did Kansas have a community health worker coalition? They did. The lady that was in charge of it had set up a meeting with me. So I clicked on it. She had an appointment time available in 15 minutes. So I clicked on it.
Wow.
And I went and sat in my hotel room and talked to her about that I was a pharmacy owner and that I'd heard about this and that I thought it would be really great. And so at first I didn't understand. And so I asked her if I could become a community health worker so I could see what it's all about. And she's like, no, because you're the pharmacist.
Okay.
And so, but what she did is she let me go through their, I can actually teach community health workers in Kansas. She let me become one of their teachers.
Nice.
And so I went through the class so that I learned more about what it was. And then after I learned that, I was like, well, this makes sense to have our delivery driver, Tom, become a CHW. So he went through, I think it's been a year and a half ago, he went through the Kansas Community Health Worker Coalition training and became a CHW. And then
Very cool.
after that, I heard about through Hesston that they had a grant program that we could apply for another technician. So decided to have Abby. I love Abby to death. She's a busybody, though, so she's a perfect CHW. 'Cause she's always got her nose in everybody's business. And sorry, Abby, if you're listening to this, I mean it as a compliment. But you want a busybody, and finding out what's out there, right? And so we had her go through, and hers was through CEI, and that's where their training was. I think Jake Galdo was involved with that, and it's more closely connected to CPSN to what the training is that they're doing. But anyway, so she was our second one, and now we have plans to send a technician from our Abilene store to go through it too, because we could do all kinds of things. Like last fall, our CHW, when he was doing the home visits, we had him we did some care planning to check in on our homebound patients, what was their plan for their flu shot. And so then he came back and we put it in their care plan. They're homebound, they don't have a plan. And then we reached out, and it ended up being that there was a group of patients that kind of lived in the same neighborhood. And so we just went out and did home visits and went door to door basically and gave everybody, we call them boosters because we gave them their flu shot and their COVID booster at the same time.
Nice.
And just took care of those patients. But it was because Tom was talking to them and finding out what their plans were.
That's
I'm
good.
here to get my Fluster in B12.
Yeah. So
There you go.